Hey guys, this is Dr. Celaya. I hope you're doing well. In our first video on B12, we talked about how it gets to where it needs to go. I know that sounds like it's an interesting thing, but it's a big deal. And to be able to understand that, we had to go through a little biochemistry, and also we had to look at what labs you need to test to determine if you have a problem with B12. And so I'm going to recap it a little bit here for you today. Then the first thing you need to do is you need to chew your food to be able to release the B12. The digestive process starts in the mouth, and there's a protein that's released by your salivary glands called haptochlorin. And what it does is it binds to B12 and it gets it through your digestive system so it's not digested, right? We want the B12 to be active and to be a form that you can use. So the B12 in your mouth has to bind to haptochlorin. Number two, we need to be able to digest our food. And the first thing is you have to have appropriate stomach acid. And it's a real big issue, especially for conditions called atrophic gastritis, which we see so frequently in people, and especially women over 50. They're not making appropriate HCl. And the other thing is the cells that make HCl also produce what we call intrinsic factor. And intrinsic factor is one of those proteins that help get B12 into the system. So it transports it from the intestinal cells into your body. Number three is pancreatic enzymes. They help digest the food and further release some of the B12, but they also separate the B12 from the haptochlorin so it can later bind to that intrinsic factor like I mentioned before. And intrinsic factor is extremely important, and there's an autoimmune condition called pernicious anemia. And that makes it so your body doesn't necessarily produce intrinsic factor. We can also have gastric bypass and ulcers that can create problems with intrinsic factor as well. And you also have genetics. There's so many different genetic conditions that can affect your transcobalamin transport mechanism, which is another thing that transports B12 through your body, or also the conversions of B12. So there's so much to be aware of when it comes to B12, and most of the time we don't have to think of anything. So we're going to take a look at the different forms of B12, which I probably bet you didn't know that there were any. So I don't know how many of you have taken vitamin B12 supplements, but they're usually little tiny pink pills that you put in your mouth and you suck on, right? They taste like cherry. And the reason that they're doing this is because it avoids that whole digestive process we've been talking about. We don't have to worry about the haptochlorin, the intrinsic factor, the transport mechanisms. Well, some of the transport mechanisms in the blood, but we're avoiding a lot of the problems that are seen with B12 deficiency. So to be able to understand the different forms of B12, we have to understand that the root word is cobalamin. And so there's different forms with different names in front of cobalamin. And the first one we look at is cyanocobalamin. I don't know, have you heard of cyanide before? Yeah, that's exactly what it is. It's easily absorbed by your body and it goes in relatively quick, but it is cyanide. When it's bound to the cobalamin, the B12, it doesn't have the toxicity, but when it's released from the cobalamin, even though it's in small amounts, I don't know about you, but I'm not real interested in having that in my body. The reason it's used is because it's cheap, it's simple, and it has a good shelf life. The number two supplement is called methylcobalamin. And there's a lot to these different supplements of B12, but the methyl version is supposed to help our conversion from homocysteine to methionine. If you don't know what that is, go back and watch my other video. The other one is called adenosylcobalamin. And here again, a different form. That is meant to help with the citric acid cycle and for us to generate energy, ATP. And here again, go back to the previous video and you'll probably see too much of that stuff you won't want to see anymore. So there's another form. There's also hydroxycobalamin, and it's another form of B12. And so we're looking at four different forms. Actually, there's a lot more. But first off, cyano, from my point of view and for the health of a patient, is off the table. I'm curious now in hydroxy, methyl, and adenosylcobalamin. Let's take a look at this little chart here to understand a little bit more about what's happening with it. We can understand, we're seeing at the very top, and you can see the abbreviations. The left one here is methylcobalamin, followed by hydroxylcobalamin, and then adenylcobalamin, and then cyanocobalamin. They all get into the body, and bottom line is they're all making cobalamin. It's a common precursor of the active form of B12. So they're all kind of going towards a B12 variety, except for, like I mentioned to you before, they may be used for different sources. The methyl may go to the homocysteine to methionine, and the adenylyl going to the formation of anergy in the citric acid cycle. And so it's a matter of how it gets into the system and how it's being used. And there's certain abilities that different forms have over others. Like, for example, the adenylcobalamin is absorbed about 67 times slower than the methylcobalamin. And you may think that's not a good thing, but it may be a good thing for the mere fact that it's time released. It's slower, which is a good thing. Right off the bat, I eliminate the cyanocobalamin. I'm not too thrilled with having the cyanide in my system, even though it may be a slow amount. I think there's better forms for us to deal with, and something that's not man-made. It's more natural. So the others fit that form. So the question arises, which form of vitamin B12 do I take? Do I take the methyl? Do I take the hydroxy? Do I take the adenylyl? Well, here's the magic answer. We don't know. We don't know what genetic conditions lead to what usages of certain B12s over others. And so it's so important to make sure to have B12 in your system, but we don't know which ones. So when I suggest B12 to most of my patients, I use all of them. We have certain supplements that contain all of them, just for the mere fact that we're not quite sure which one is the best form, which ones utilize the best and easiest, and what goes to what portions of our systems. We don't really know. So to be able to utilize all of them, I think, is extremely important. So using supplements that have all of them in, I think at this point in time, I think we're doing our body a service. Who knows? Later on, we may find different forms may be more advantageous. But for now, I'm sticking to all three. So the big question lies, how much B12 do I take a day? Well, that's a tough question. You have a lot of genetic conditions to take into account. There's a lot of independent things to look at. In addition to, you have to consider malabsorption. The RDA says we should have about 2.4 micrograms a day if you're under 50, and between 150 to 200 micrograms a day if you're over 50. They see a big difference there. There's malabsorption problems. Vegan societies say that you should eat fortified foods 2 to 3 times a day, which I'm not too keen with because you're dealing with cyanocobalamin, right? The cyanide version of it. Or they say 10 micrograms or 2,000 micrograms in a week. Well, the thing you really need to make sure you take into account is absorption issues can increase your dosage needs about 100 times higher than normal. Which are you? I don't know about you, but I'm not willing to take into account that I'm the one that absorbs well. It's just an easy supplement to take. Because chromosomal issues leading to DNA damage can happen from a lack of B12. And oh, by the way, make sure you take B12 with folate. I like to give the form 5-MTHF. And with B12 dosages, I usually base it off of lab testing. Remember homocysteine and methylmalonic acid? And so B12 is extremely important. And if you have questions regarding your B12 levels and want to know more, go over to my website, drcelaya.com, and schedule for a free 15-minute consult. We can talk all about it.